everyone. My name is Alyssa Allen, and I'm doing my presentation on diabetes. After reviewing this presentation, the attendee will be able to first define type 1 and type 2 diabetes, the prevalence in populations, and factors that contribute to these differences. Secondly, they will be able to identify symptoms associated with type 1 and type 2 diabetes, and treatments, medical and behavioral. Lastly, they will be able to understand the application of social work interventions on a micro, meso, and macro level. Moving on to slide 3. So there's two types of diabetes. There's type 1, which is where the body lacks the production of insulin. Type 2 is when the body fails to use insulin appropriately. 34.2 million people of all ages in the United States have diabetes. That's 10.5% of the US population. The CDC actually conducts the National Health Nutrition Examination Survey between 2001 and 2016, and it assesses the health status of non-institutionalized civilian populations. According to the study, the prevalence of diagnosed diabetes was highest among American Indians and Alaska Natives at 14.7%, followed by Hispanic origin, 12.5%, non-Hispanic blacks, 11.7%, followed by non-Hispanic Asians at 9.2%, and non-Hispanic whites at 7.5%. After that study was conducted, they analyzed that Asian and Hispanic populations are more likely than Europeans and African populations to suffer from diabetes. 1 in 10 people suffer from diabetes, which is double the amount of people than 1980. The differences in race and ethnicity, there's factors that are contributed to that, which are environment, genetics, epigenetics, and lifestyle. Moving on to slide 4. So diabetes is a chronic disease, and if one doesn't take care of their diabetes, it can progress and become very fatal, and or they could lose a limb. Risk factors that may create the onset of type 2 diabetes are high blood pressure, high cholesterol, and obesity. Symptoms vary from type 1 to type 2. People who experience type 1 diabetes may experience a very sudden onset of symptoms, while people who experience type 2 may experience more gradual set of symptoms or no symptoms at all. Some patients may experience diabetic ketosis before the diagnosis is made. This happens when the blood glucose is extremely high. Symptoms include, but are not limited to, feeling very thirsty, blurry vision, extreme fatigue, feeling very hungry, weight loss, cuts and bruises are slowly healing, tingling and pain in the hands and the feet. Treatments, there's 2 types of treatments. You can do medication and behavioral. Medications are oral medication or insulin. Insulin is usually administered through the glucose meter or a shot, which is where the integration of behavioral health and medical health take place because of the adherence to this medication. The glucose meter is just continuing to monitor one's glucose blood level, and if it's low, it will administer the insulin. You may need to check this device because it is technology and it does have glitches. There's also the system where you can poke your finger and give yourself a shot. Behavioral changes can be made through cognitive behavioral therapy and motivational interviewing in areas such as diet, physical activity, and blood glucose check. The practice of social work on a micro level entails individual interventions. This may be helping them find strategies to integrate diabetes into their life, assist in creating effective coping strategies, assist in finding resources such as affordable glucose meters, access to mental health services, and assist in accessing medical insurance is very important when it comes to diabetes because the medication is extremely expensive, even with insurance. Um, Finally, eating healthy. The American Heart Association and the American Diabetic Association both have recipes on their website for ways in which you can eat healthier. So moving on to the mesopractice, which is community interventions. Some that could be useful for diabetic patients are support groups, spiritual and religious groups, nutritional education classes slash groups, incorporating social and environmental factors into interventions at the community level is also important, and exercising accountability groups and educating the caretakers on the chronic disease of diabetes. On a macro level, society intervention level, um, as a social worker, I would advocate at the state and federal level. Examples would be to advocate for programs to subsidize costs of insulin pumps because they are very expensive, and even with insurance, people are unable to afford them. Also advocating for free test strips so that people are able to self-monitor their diabetes. The first thing I learned from this course that has helped with the development of my presentation is how important it is to assist patients in their treatment planning. Ensuring that psychosocial and behavioral factors are considered when creating a treatment plan. Secondly, how a community's health is affected by social circumstances and physical environment, and how a patient provides self-care for their diabetes is influenced by the same circumstances. For example, somebody who needs to be more active because of diabetes, they may have the barrier of there's not enough gyms within their community or they're very far away. The last thing I wanted to go over is what I learned in the class that will help me in my future jobs or my future classes, and that's integrated behavioral health care and addressing the whole person. I will use integrated behavioral health care in the future as a more holistic approach to maintain one's chronic disease. This integration is extremely important when it comes to chronic disease because, like diabetes, there's several others, but the best course and outcomes of diabetic patients is their behavioral and lifestyle choices. And as a social worker, my role on an integrated behavioral health care team would be to conduct a psychosocial assessment.